Welcome. We'll be getting started in just 1 minute. We're just letting a few more folks get connected here. Welcome, everyone. We are giving folks just a few seconds to get their audio connected, but we'll be getting started shortly. Thank you. Welcome, everyone. Good morning or good afternoon, depending on what time zone you're joining us from. I'm Abra Lyons-Warren, Director of Cross-Sector Initiatives at the Council of Large Public Housing Authorities. We're glad to have so many of you join us at the 7th Annual HousingIs Summit, the preeminent cross-sector convening of leaders from the affordable housing, health, and education sectors focused on improving life outcomes for low-income people and communities. So here we are, a year plus in, virtual again. The good news is you're all pros at Zoom now, and the virtual format allows us to accommodate significantly more people than in person. We hope our sessions and content are valuable and that you are able to connect with even more colleagues than in past years. A few tech logistics, all of you are muted, so please chat any questions you have to the hosts by using the chat feature, which can be found on the bottom of your screen if you're using a computer, or in the top right if you're joining us via a tablet. We will be using the chat to receive questions for the official Q&A portion after our plenary panel, but feel free to enter questions at any time. No need to wait until the end. We are recording right now, and we will be recording every session. So you can catch the breakouts you couldn't attend, revisit panels at a later date, and share recordings with colleagues. Please fill out the evaluations at the end of each day. We will be posting links in the chat, as well as emailing them to you. And your feedback is helpful to us as we plan future events. So we really do appreciate you taking a few minutes to fill those out. We also invite you to join us on Twitter at housing_is, and by using the hashtag HousingIs2021. For those of you who are new to the HousingIs initiative, we started with the premise that housing is that first critical step to provide stability for individuals and families, but it's not sufficient if we want to improve life outcomes. So we began to look at how we could better intersect housing and other areas like education and health. We believe that partnerships are key to success in this arena, and that a collaboration across systems and sectors through shared goals, focused resources, and coordinated efforts strengthens our collective ability to serve low-income individuals and families effectively and efficiently. We're so pleased to highlight the innovative partnerships our member housing authorities have, and we disseminate lessons learned from their efforts to others hoping to replicate their work. We do this at the conference every year and throughout the rest of the time. Our work focuses on prenatal all the way up to older adults across all the different sectors, and you'll see examples of that rich work reflected in our sessions over the next 3 days. The COVID-19 pandemic has exacerbated issues we have long been focused on: the digital divide, unequal access to resources and support, the populations that disproportionately suffer health and educational consequences. And I have not been surprised at all how all of you have quickly and nimbly shifted your work to address the emergency and then ongoing needs of our shared residents. This past year has underscored once again the critical importance of partnerships and shown that our premise at the HousingIs initiative is an imperative one. When I'm being cautiously optimistic, I like to think the pandemic and the increased focus on deep inequalities in this country will force more impactful and lasting change. But regardless, I am buoyed knowing the work you all do every day is making a very real difference and continues to be a model for others across the country. I hope over the next 3 days, you meet new partners, learn from communities, and feel invigorated to jumpstart new ideas. I hope this summit is a space for all of you to continue and increase your vital efforts and the role we can all play in helping to dismantle inequities. The summit is intended to be a space for open dialogue, active listening, and constant learning, whether we're roundtables in person or meeting via Zoom. I'm so pleased to welcome you to the summit, and I'm excited to hear from our esteemed panelists and attendees. I would like to thank the CLPHA staff, including our intern, Hannah Allison, who has worked tirelessly to help put together this event, and extend a public welcome to our new health policy manager, Camille Anole, who has jumped right in. I would also like to thank all of our speakers for sharing their time and expertise. And finally, I would like to thank this year's sponsors, some of whom will be sharing some welcoming remarks with us as well. Their support is critical to our ongoing work. And now I'd like to turn it over to one of those sponsors, Jeff Bischoff from Yardi Systems Incorporated. Jeff?
Thank you so much, Abra. Good morning and good afternoon, everyone. As Abra mentioned, my name is Jeff Bischoff, and I lead our team of Yardi ambassadors. CLPHA, on behalf of Yardi, I'd like to thank you for the opportunity to both sponsor and present this week. And I'm certainly grateful for the chance to connect with all of you today. During times like these, Yardi leans heavily on its company motto. And that motto is to take care of our clients, take care of our employees, take care of our communities, stay focused, and grow. When it comes to taking care of our clients, we're noticing trends where agencies are looking to diversify and find new revenue streams in order to grow. And we're even seeing agencies simply want to enhance their technology. In order to support agencies through these initiatives, Yardi has consciously doubled its staff size over the last few years. And our plan is to continue to scale in order to best support housing authorities. Yardi's commitment to taking care of its employees has never wavered. Whether we're in the office or at home, Yardi's staff has all the tools they need to perform their jobs and support their clients well. And when it comes to taking care of our communities, Yardi has seized an opportunity to donate more than $4 million to food banks across the country and $1 million to the COVID-19 Rental Housing Support Initiative. And earlier this year, we began supporting state and local governments with our new rent relief solution. And that solution is designed to support the Emergency Rental Assistance Program. And finally, when it comes to staying focused and growing, we've remained thoughtful with agencies' needs as a whole. We now offer a comprehensive solution for PHAs of all sizes and complexities, which we're very excited about. And our commitment to the housing industry has never been stronger, and we're truly energized to help agencies grow and meet their needs. We're thankful for all the work that you do, and we're grateful for the opportunity to support you all. I look forward to connecting this week. And again, CLPHA, I want to say thank you for the opportunity, and thank you to everybody for your time. Back to you, Abra.
Thanks so much, Jeff. And I do want to note just our other sponsors, KeyBank. Tony was not able to join us at the last minute, but we very much appreciate their support, as well as our next sponsor, who I'd like to invite to speak, which is Andy McMahon from United Healthcare Community and State.
Great. Thanks so much, Abra. And thank you, Sonia and Stephen and the whole CLPHA team and board. And most importantly, honestly, all of you at the PHAs working on the ground tirelessly, and your partners in the community that are improving the lives of individuals. So my hat and the hat of United Healthcare is off to all of you for the incredible work you do. We've had the good fortune here at United Healthcare to partner with CLPHA for several years and have seen enormous benefits in the focused interest on aligning healthcare and housing resources and capabilities and initiatives to improve the health outcomes for people living in publicly subsidized housing and other people living in the communities where you all as PHAs are residing and working tirelessly to support and house folks. So just a huge note of gratitude from us. I think the strength of our partnership with CLPHA, I think, has never been stronger than it is today, and we look forward to expanding and increasing our partnership as we look at the days and weeks and years ahead. So, you know, we are focused. I work primarily on our Medicaid population, which has an enormous overlap with people living in publicly assisted housing. So we are working with several of you already and excited to expand those partnerships and work with even more of you as we go through 2021 and beyond. So thank you, CLPHA, for your partnership, and thanks to all of you for all the amazing work you guys do on the ground each and every day. Thanks.
Thank you so much, Andy. And likewise, we very much appreciate your partnership and love working with you. So I think with that, I would love to next introduce CLPHA's Executive Director, Sonia Zaderman. And Sonia, take it away.
Great. Thank you so much, Abra and Jeff and Andy. Welcome to, hard to believe, but our 7th annual National HousingIs Summit. And to me, this is proof of concept that people keep joining us and we're growing. We have over 800 registrants for this meeting, which suggests there's a growing interest and need to connect to people across sectors. And hopefully next year we will, I should say hopefully, no, absolutely, we will be in Washington, DC next year, so we can be together in the same room and be in person. We're looking forward to that. Of course, my deepest thanks to Abra Lyons-Warren and Camille Anol, our newest staff person at HousingIs, and Hannah Allison for their work. I just want to recognize Steve Lucas, who has left us to go to HUD, the Office of Public and Indian Housing, and we hope everything he's done at CLPHA will be imbued over at HUD as well. Deepest thanks to our sponsors, Yardi Systems, Key Bank, and United Health, and a particular shout out to Andy McMahon, who has really been a leader representing United Health on bringing managed care to the table in growing these partnerships, both in partnership and investments. And this is going to be critical in our ability to scale and replicate innovations we're seeing in the field. Wordsworth said, "The lowest ebb is the turn of the tide." And I believe the tide has turned for us, and it's come through a global health crisis that's really brought a reckoning, a rethinking, and finally, and hopefully, a reinvestment in the basic infrastructure of our national safety net. The reckoning with the systematic and institutionalized racism, and that our basic systems of delivering health, education, and housing are deeply unequal for people of color and low-income households. It's a rethinking and a re-understanding that the safety net systems are essential to national health and economic stability, and an understanding that people must be housed. This crisis brought us action and urgency and dollars to accomplish this. And finally, a recognition that reinvestment is critical. We see it represented in the American Jobs and Families Plan, plans that have been introduced by the administration and are being debated in Congress, it begins to redefine what infrastructure means. It redefines infrastructure to benefit women, children, and seniors, as well as traditional jobs, to lift them out of poverty, and to recognize that essential workers and caregiving falls primarily to women and has been deeply, systematically unequal. So we've come to some better and deeper understandings. We now have to go through a political process that puts this deeper understanding into practice. And it brings me to a thought from Maya Angelou. History, despite its wrenching pain, cannot be unlived, but if faced with courage, need not be lived again. And that, I think, is really our work at HousingIs, as we distill this work and refine it and grow it, elements that are critical to success are data, partnerships, investment, alignment, and equity. And I think the work that's being done by all of you in the field are bringing these streams together to be more powerful and effective. And what we are trying to do on the HousingIs side is to lead and contribute to the field in terms of thought leadership, in terms of research, and developing communities of practice, to be the go-to resource for practitioners, policymakers, and researchers, to lead in cross-sector data sharing and data analytics initiatives, to forge strategic partnerships, and to translate research to policy, to practice, to action, and to actually benefit individuals. It's been a trying year for everyone, but we are immensely proud of the housing authorities and their partners that have risen to the challenge during the pandemic. We were extremely pleased to receive a grant from the Center on Disaster Philanthropy to support efforts by housing authorities and their partners. And to us, this was a validation and recognition that housing authorities, housing providers, and this network partnership are essential and must be invested in and built up. We're also creating targeted cohorts to foster peer learning. We find this has been most productive to understand really as the practice hits the ground, how we can support practitioners in the field. And of course, this is demonstrated through our post-secondary Leadership Institute and our ongoing partnership with United Health and our aligning health and housing work. Data sharing and the digital divide. We need to know where the gaps are. We need to know who is serving whom and how and when, and if it can be done better. And we need to reconnect everyone into our economy, which is essential in terms of digital access. In terms of ways we can support that, our online clearinghouse, HousingIs.org, contains over 900 articles, toolkits, resources, and cross-sector efforts descriptions. We've got over 40 active communities on the website. We've done a lot of work. We've been very busy, but there's much to be done. And it brings me to my concluding thought that's framed by a Zimbabwe proverb. The axe forgets, the tree remembers. So the damage that we have done to systems by disinvesting, by making them unequal, the systematic discrimination that people have encountered, those are wounds to the tree that we must recognize. But we are in a new era, and I'll mix my metaphors. The tide has turned, and now we are looking forward to robust partnership with the administration and Congress in ways to incentivize these cross-sector partnerships and to really rebuild a robust social safety net that allows everyone in this country to thrive. Thank you so much again. And I just want to reemphasize where we want to do our work: data, partnerships, investment, alignment, and equity. Thank you for joining us. I think you will have quite an experience the next 3 days that will bring new thinking and new learning to you. And my last thought is next year in Washington, D.C. Thank you very much. And now I'm going to hand it over to Stephen Norman, who is the president of the CLPHA board, as well as running the King County Housing Authority, and has been a leader in cross-sector work and also pioneering work in expanding housing opportunities through mobility strategies. Thank you, Stephen, for your leadership. Back to you.
Thank you, Sonia. Let me join Sonia, the CLPHA staff, the CLPHA board, the sponsors, in welcoming everyone. We have over 800 folks registered, which is phenomenal. I remember 7 years ago when we worked hard to fill a relatively small room and people would ask us, housing is what? We have come a long way, and I think this is truly the issue of the moment. I'm enormously heartened about where we currently stand and about the potential moving forward. I have to tell you what a difference 4 months has made. The pandemic made absolutely clear how critical housing is, how safe, affordable housing is a crucial first step in addressing our most pressing issues, from racial justice to social mobility to public health, the issues that matter in our communities. You only have to walk the streets of most of our major cities, or look at statistics about homeless students, or about racial disparities in household wealth to see how badly we are failing at this and how far we have to go. For the past generation, public housing and public housing authorities have struggled with the ongoing disinvestment in the public housing inventory. We've been consumed with issues of leaking roofs, broken boilers, mold, lead paint. Slowly, we have made progress. Hope 6, Choice Neighborhoods, RAD. But in truth, we have continued in many cases to lose ground. The new investments proposed by the Biden-Harris administration and by Congress hold real promise. Promise for finally recapitalizing these critical public assets and for providing housing subsidies for everyone who needs them. It is absolutely critical that these initiatives pass out of Congress and become reality. What this will mean as the inventory is increasingly revitalized and reimagined, and as housing assistance expands to meet the overwhelming need, is that public housing authorities can begin to lean back into their real mission, which is about social impact, about strengthening communities, and about providing opportunity. So how can our housing program support these big picture outcomes that we're looking for as a society? Over the next 3 days, we will dig into this. We'll look at health, child poverty, education, homelessness, digital access, geographic choice, and much more. We'll look at all of this front and center through a racial justice and equity lens. We'll look at partnerships, at cross-silo initiatives such as the health partnership that has grown out of the work between CLPHA, the Corporation for Supportive Housing, and United Healthcare. Thank you, Andy. And we will continue to wrestle with data, how to share it, how to use it, how do we measure and demonstrate real results. We will learn from our successes over the past year in supporting our communities and residents during the pandemic. I'd like to also acknowledge the accomplishments of so many housing authorities in keeping their residents safe, supporting virtual learning, delivering meals, performing wellness checks, and getting folks vaccinated. The industry truly stepped up to meet the challenge of COVID-19. And I think in doing so, we've provided a glimpse at exactly how pivotal a role housing and housing authorities can play in supporting our most vulnerable communities. Half the importance of this conference is in the discussions that will take place this week as we share and learn. The second, actually more important half, will take place once the calls end. The real test is in how successfully we take the innovations and research and learnings from this week back to the communities we serve. The true measure of value of this convening will be on the ground back home. To help with this, CLPHA is supporting ongoing communities of practice. We urge you to stay connected. The peer learning now goes on all year round. We also need to continue to advocate across sectors for the critical resources we need from Washington, D.C. This is a powerful coalition. Housers, educators, healthcare providers, advocates, philanthropies, local government, all speaking with one voice. Together, we can make a difference. We can make an impact here in Washington, D.C., and that impact will be critical for the resources we need to do what we need to do on the ground. So welcome to CLPHA's 7th annual HousingIs convening. My thanks to Sunya and the CLPHA staff for pulling all of this together. They almost make it look easy. And most especially though, my thanks to everyone here for the work you do every day on the ground. I hope to see you all in person next year. Enjoy the day.
Thank you so much, Stephen and Sonia. I could not agree more with what both of you have said and laid out. And we really are just very excited for you all to join us over the next couple of days. So without further ado, I'm pleased to introduce our next panel. As you've heard from everyone this morning, and as you know from living it, the past over a year has really had quite an impact on all of our lives and the lives of those that we are working to help. So I'm pleased that we have a presentation this morning focused on what have we seen and what's to come. What might we be able to expect in the coming months? You heard Stephen allude to some of the very impressive and vast efforts that housing authorities have engaged in as critical anchor institutions in their communities. So we'll hear a little bit more about that from one housing authority in particular, as well as perspectives from the medical community and from the administration. So I will let our panelists introduce themselves further. But again, if you have questions, please do go ahead and put them in the chat. We will have time at the end to answer some of those. So with that, I'm going to turn it over to Rupali Lamay. Rupali.
Hi, everyone. I hope you can hear me okay. Sorry, I'm running and I'm trying to be on double meetings at the same time. So thank you so much for that warm introduction, and I'm just running on here. So my name is Rupali Lamay. I am a faculty member in the School of Public Health at the Johns Hopkins Bloomberg School of Public Health. I serve in the Department of International Health as well as Epidemiology and Health Behavior and Society, and I study vaccine hesitancy. And so, as you can imagine, I have been a little busy over the last year with the vaccine rollout. And so I just wanted to have just a few very, very short remarks, if you will, and I'll keep this very short. Please feel free to ask questions in the chat. I will get to those as well. So I want to start with some good news. The good news is that we have 3 products that are currently here in the United States that are available, right? We have the 2 mRNA products, the Moderna and the Pfizer product. We also have the Johnson & Johnson product. And the great news with this is that we have been making some great strides with regards to vaccinating the US population. As of May 3rd, I believe we had been able to vaccinate 45% of those that are eligible here in the US have gotten at least 1 dose. We're right around 33% of individuals that have now been fully vaccinated. And so this is some really, really great news. The other great news that came out this week that actually just came out yesterday finally was that the emergency use authorization has been approved for Pfizer in the 12 to 15 age group. This is a huge, huge, huge benefit for those of us that work in this space for understanding the ways in which we can continue to vaccinate those that are younger and using something called age de-escalation. So this is a huge challenge. If I can go to a little bit of doom and gloom, and I promise I'll come back to a positive spin at the end of this, is that I've been studying hesitancy for about 7 years now. And previous to this pandemic, essentially people were hesitant and did not want to take a vaccine for essentially 4 main reasons. So the first was vaccine ingredients. People were concerned about what exactly is in the vaccine, what is it going to do to my body. The second had to do with the vaccine schedule. And remember, previous to COVID, hesitancy was really focused on childhood vaccines. So this was really parents asking, why does my child need 4 doses of Tdap, for example? Why do they need 3 doses of MMR? The third had to do with risk perception. People just had not heard of these diseases, had not seen these diseases in their lifetimes. And even if they had seen these diseases, did not feel as though that the disease was severe enough for them to warrant an action, i.e. getting a vaccine. The last that we traditionally have heard was this issue of people really felt as though that people have this misperception, I should say, that vaccines can cause an adverse event such as autism. This has been soundly refuted by independent scientists over and over again. However, this myth continues to persist and we continue to deal with that as an issue. So how has that changed really, right? So this was pre-COVID. There was essentially 4 main concerns as to why people did not want to get a vaccine. That has shifted quite a bit over this last year, and I would argue for about a couple of reasons. The first is that distrust in the government is at an all-time high. Previous to COVID, if you sort of track trust in health authorities as well as just public authorities in general, it had been on the decline. There was a meta-analysis that was done, I believe, in about 2016 that looked at Americans' trust in public authorities here in the United States and had been on a gradual decline. You add on to that this issue that people really feel as though that the vaccine development process was politicized, right? Individuals think that certain recommendations, certain interventions are essentially implemented for political gain. And that really caused people to sort of have pause. This has been happening within, I think, sort of a backdrop, if you will, of polarization and misinformation. And I won't go into detail into either of these things, but I think you all are probably pretty aware of how this has shifted the conversation around vaccines. And for those of us that work in behavioral science, has been a real challenge. You know, while 10 years ago, you may have spoken to someone that thought differently than you do from a political ideological perspective, that's less and less rare now, right? We sort of have moved into these echo chambers where we talk to people that believe with what we believe with. And as a result, it becomes really hard to convince people to do something or believe in something that they have really cemented their attitude in. Misinformation has been a huge, huge challenge, not only here in the United States, but globally. And actually, there have been studies that have found that people are actually exposed to more inaccurate information than accurate information with regards to the vaccine. And so what can we do, right? In a nutshell, what do we do? So challenging situation for those of us that work in this space. We're trying to get individuals protected because that's really the most important thing here. How do we reduce morbidity and how do we reduce mortality? The United States is on a great sort of clip right now, if you will. If you look at the numbers, we've seen, several daily declines, not only in number of cases being reported, but in hospitalization as well as mortality and death. But the issue is our work is far from done. I think you've heard essentially that now demand is not outstripping supply, that we're hearing from all across all these different states that people are like, we have doses, people are just not coming. You look at the numbers then and you say, well, only 45% of people have gotten 1 dose and 33% have gotten a full dose. We still have a long way to go, and we do. And the problem with that is that we need to continue to be vigilant and we need to continue to think about the ways in which we're communicating to people so that they can make an evidence-based decision about a vaccine. So how do we do that? There's essentially 3 things I want to highlight. One is transparency. How do we talk about side effects? How do we talk about where you can get the vaccine? How do we talk about if you have to have a waiting line, if you have to sign up online? We need to be transparent in all of that communication. The second thing I would say is how we need to be proactive in any sort of communication we're talking about when we're trying to convince someone about the vaccine and the benefits of the vaccine. Is that here's what we know. Here's what we know about the EUA for 12 to 15-year-olds. Here's what we know about the EUA that might be coming for 9 to 12-year-olds, because those individuals, it's currently in clinical trial development. The third piece I would say, and I'll end on this note, is that this seems very, very, very basic, but the most important thing that we can do is that, as I mentioned before, there's a lot of distrust. And whether or not you are in any way, shape, or form connected to the healthcare system, that distrust seems to be flooding and bleeding over into the government in general. So if there's any way that we can think about how do we build trust, it's through empathy. It's really making sure that people are living in an uncertain time. It's being able to sit and listen to people that might have different opposing views than you do on whatever it is, and just really acting in a way in which that we should be in terms of humanistic and making sure that we're using that approach. I think in terms of the work that you all are doing, you all play such an important role in making sure people have accurate information, that they have credible information, and that they have evidence-based information. And particularly because a lot of individuals that live, within buildings that you all are probably involved in are in high congregate settings, it's really important to make sure that these individuals who unfortunately are at higher risk of exposure are well aware of the benefits of getting the vaccine as well as the risks of getting the vaccine. So I'll pause there. I don't want to belabor this point. I think there's a lot of positive things that have happened. And for those of us that are in this space, I think getting the vaccine was very personal for many, many of us. And at the same time, we still know that now getting this last segment of the population vaccinated is actually going to be the hardest part of this whole pandemic, essentially to reach, community immunity or whatever you want to call it, if you want to call it herd immunity. So I will stop there and I'll turn it back over to Abra. It was great to be able to be here and connect with you all.
Thank you so much. That was a great and helpful overview. And yes, we're very, I'm sure a lot of people were very excited to hear, if you hadn't seen in the last day or so, about the authorization for 12 to 15-year-olds. So thank you for sharing that as well. Next, I'd like to turn it over to Richard Cho from HUD. Richard?
Great, thank you, Abra, and thank you, Dr. LeMay, for that as well. I'm Richard Cho. I'm Senior Advisor to Secretary Fudge for Housing and Services at HUD, and I certainly bring you her greetings to all of you. Let me first start by saying that my role at HUD is to advise Secretary Fudge on all of the intersections between housing and services, housing and healthcare. I'll just note that when I was offered this position, my thought was that I would be focusing on homelessness, on the intersection between public housing and healthcare programs, on looking at the needs of older adults and people with disabilities. And what I was told was, yes, all of that, but also COVID. And so I'm also our point on coordinating our on HUD's COVID-19 response. I want to thank CLPHA for asking me to join this. I'll note that I think it was my first week on the job that Sonia reached out and said, hey, you got to help us on vaccines and bring vaccination. So I just want to give a shout out to Sonia and the folks at CLPHA for really prioritizing that issue. And Steve Norman, good to see you as always. I think I've known you for I don't know, 20 years now. Great to see you here as well. Let me say we've been doing quite a bit of work and it's taken a bit of time for us to get to the point. Tomorrow, we will be announcing a new joint effort in partnership with HHS, where HUD and HHS will be encouraging the now 1,470 community health centers that have been part of the federal health center vaccine program to proactively partner with all HUD-assisted housing and homeless services to bring vaccines as much as possible to public housing residents, to owners of our multifamily housing portfolio, as well as to homeless shelters and other homeless populations. Very excited that joint communication will be coming out along with a set of tools and resources where we will be strongly encouraging those on-the-ground partnerships. It took a while for us to get here, and let me just explain why. When the administration arrived, we realized that the vaccine supply nationally was not what it needed to be. The immediate focus was on ensuring that we had adequate vaccine supply. We're able to bring on all 3 vaccines, but also increase availability. And a lot of the push, as Dr. LeMay mentioned, was about overcoming vaccine hesitancy, thinking about mass distribution efforts, while that supply was increasing. We had heard and knew about a number of places where housing authorities had partnered with public health departments, with hospital systems, with community health centers to bring vaccines and partner on vaccine access. I do want to thank all of you who did engage in those really early efforts to connect your residents to vaccines. That was heroic work. It's definitely the model that we've been pointing to and certainly have been highlighting in a number of our communications, instances where we've heard fantastic work by housing authorities to proactively partner on vaccines. At the same time, we know the supply was increasing as distribution channels were being opened up. And we're now at a different point. Sonia, your optimistic tone that you set is spot on. We're at a different place now as President Biden has announced 200 million shots have now been delivered. now 40% of our adults have been fully vaccinated, things are moving in the right direction. And there are many places now where vaccine supply actually is now outpacing demand in terms of people actually who are seeking vaccines. So the administration is now thinking about a different kind of approach where we are both ensuring that we're conducting targeted efforts to reach populations that have not yet received vaccines, either because of hesitancy or frankly because of lack of access. With respect to what HUD's concern is on ensuring that the very kind of vulnerable people who live in HUD-assisted housing, whether you're talking about older adults who live in our older adult housing or in public housing, people with disabilities or who have mobility issues or transportation barriers, or people who are experiencing homelessness, who may not know how to actually register or may not have internet access. Those are the places where we know we need to make specific targeted efforts. And so our focus now, given that the supply of vaccines is now adequate, is ensuring that we're doing our part to conduct those micro-targeted efforts where we know that there's residents within public housing settings or other HUD-assisted housing that have not yet received vaccines. And so we'll be doing our part to connect the dots. So coupled with that joint letter that will come from Secretary Becerra as well as Secretary Fudge to all health centers as well as all housing authorities, multifamily owners, and homeless programs, we'll also be issuing a mapping tool that will enable housing authorities to be able to locate their nearest health center that has access to vaccines, and also vice versa, and also identifies places where the distance between health centers and say public housing sites are too great, and we're really conducting some specific targeted efforts to try to identify those and support those public housing sites as well. So again, I'm leaking a little bit of information because we are planning to do an event tomorrow to really highlight that letter and some of the tools that we'll be issuing that I mentioned. But I wanted to make sure all of you are aware about this new opportunity. And again, HUD want to hear from you, to reach out to our Office of Public and Evening Housing if you're looking for specific support, if you have a public housing development that has even a small number, if not a majority of your residents who have not yet been vaccinated, to please reach out to us so we can help you broker connection with your the nearest federally qualified health center that's part of the vaccine program that can bring vaccines. And again, our model and our paradigm is, in many cases, what it takes is to bring vaccines on site to make it as easy as possible for residents to receive vaccines, as well as comparing that with outreach by trusted medical professionals, community health workers, that can help ensure that residents have the information they need to feel confident about the vaccine safety and effectiveness. So with that, I'll turn this back to you, Abra, and certainly I'm happy to entertain any questions about our work thus far. Oh, the one thing I'll say is, I think strengthening the connections with health centers, and I know many of you already have partnerships with health centers, is key. Because that partnership is going to be critical even beyond COVID-19. And certainly the focus right now is on vaccines, but I think there's tremendous opportunities in thinking about the ways that we can connect the dots between the many roles that community health centers can play in supporting public housing residents beyond primary care and COVID response, but also to support them in many other ways as well. So we certainly hope that many housing authorities will take advantage of this opportunity for us to connect the dots between health centers through the vaccine program, but that can lay the groundwork for partnerships beyond. Abra?
Great, thank you so much. And I think I'll just go ahead and turn it over to Vivian Brady Phillips from the Jersey City Housing Authority. Vivian? I think you are muted.
My apologies. Thank you, Abra. Really, really pleased to be here on such an impressive panel. Thank you, Doctor, and thank you, Mr. Cho. I am the Executive Director of the Jersey City Housing Authority. We're the second largest housing authority in the state of New Jersey. And we actually are located right across the river from New York City. So last spring, we were at the epicenter. Many of our residents, work in New York City, and we faced many of the challenges that we all first heard about in the spring. in New York. And I'm just going to share my screen to talk a little bit about what our experience was with regard to COVID, the experience of our residents, of our staff, and what it was like for us being a housing authority that was early impacted by COVID-19. So let me just see if I can pull this up here. My apologies. Well, I'm going to go ahead because I'm having a little bit of a screen sharing and just tell you a little bit about what our experience was. I would have to say that the story I'd like to tell about COVID-19 at the Jersey City Housing Authority was really about collaboration with key partners. The City of Jersey City, its Health and Human Services Department, was a key support for guidance. I also want to take the time to say that the regular CLPHA briefings were an enormous resource for us in terms of peer support. And the work with a variety of agencies and organizations who really pulled together to give us guidance, critical resident supports, and the information we needed to make good decisions on the ground. So from the outset, we had the opportunity to collaborate with the mayor's office, which had regular meetings for city agencies and departments. And so we were at the table for critical citywide updates. We quickly recalibrated to make sure that we had enough PPE supplies, but it was the Jersey City Office of Emergency Management that provided resources when we had gaps. They also helped us with electronic temperature and mass scanners. And we then turned to the work of the City Department of Health, which was collaborating both with the state and the federal agencies to provide weekly site-based COVID-19 testing for both residents and staff that continue today. And we now continue to do that with on-site vaccinations. We were also incredibly lucky to have the policy guidance, both from the CLPHA meetings and our work with the Health and Human Services Department to help guide us as we had to make key decisions about testing for staff and how we were going to implement the types of resources and strategies we needed to make sure that we could continue to deliver services to residents without any gaps. So we, on the staff reorganization, I remember that day when we all looked at each other in early March and said, we've got to make a plan and we've got to get everybody out of here. We put together work at home plans for those who could work at home. And we put together reorganization plans for our site-based staff to make sure that we could practice social distancing and have the practices in place so that we could keep everybody safe. In those early days, we were issuing policy documents and new ways of working. It felt like on a weekly basis. What did it mean to provide work orders during the time of COVID, right? What do we do if someone wants to work in a hybrid way? We also had the additional challenge of having many of our staff members who were parents with a school system that was operating remotely. So all of these types of issues were very challenging, and we had to really look at HUD guidance, of course, the guidance of our public health authorities, and through the network of partners. On the resident side, we have tremendous issues with food insecurity. And so in our early days, we were able to work with the Department of Health to transition a significant number of residents, seniors and others and disabled onto a Meals on Wheels platform, and then developed partnerships with the Food Bank of New Jersey and other local nonprofits to have regular food deliveries for our residents. We dealt with the issue of seniors in isolation, right? We really worked on a communications plan where we used a wide variety of strategies. We did well over 1,000 calls, wellness calls, during the first 2 months of the pandemic to check in on our most vulnerable. And one thing that I think we had always been concerned about was the challenge of digital literacy. And it took on an additional sense of urgency during the early days of the pandemic, continuing on to now. So we wound up, we had put together computer labs at all of our sites and had gotten some grant support and also had an AARP grant that gave us access to tablets. And so at the same time that we were making sure that our staff members had adequate IT support at home by buying many new devices, we also worked to spread devices out to vulnerable families. The public library reserved a significant number of hotspots for us so that we could ensure that children could learn at home. All of this had to happen in what seemed like we needed to have it before we even knew we needed it. And so I'm very grateful to the staff at the Housing Authority who was creative and really worked with the partners that they had in the field. I don't think we would have had the approach and the successes that we did in terms of serving resident needs if those partnerships had not been in place before the pandemic happened. Our partnership with the Department of Public Health, Department of Health and Human Services in Jersey City has always been strong. We've collaborated with them on things like mental health training for all of our staff members. Those are the types of relationships that were and continue to be critical for us in this work. And from a resident perspective, I think one of the key challenges that we continue to face and figure out is communication. And that comes through when it comes to the issue of testing, and as the prior speakers have spoken about with vaccines. We are very lucky to have now already done 4 site-based vaccine events, and we continue to do those. We think the site-based vaccine approach is critical because even though we are a city that is only 15 miles, like many urban areas, getting from one end of the city to another is enormously challenging, particularly for the residents that we serve. And so for us, the capacity on the city end and our organization to host regular vaccine and testing events is very, very important. That said, we still struggle with the communication about the safety of vaccines and what people need to know to be comfortable. We have seen very, very strong engagement at our senior sites. I will say on the vaccine front, we still have a way to go in terms of participation for site-based vaccination at our sites. That's just a little bit of an overview of our experience as a housing authority. I think making sure that we had critical resident supports was really rooted in a strong partnership with the Department of Health, our partners who helped us pivot and make sure we could provide the types of food security and other services, and a deep commitment to digital connectivity to ensure that we could communicate effectively with our residents and continue our efforts. And with that, I think now, I'd love to hear a little bit more from our panelists, our other panelists, about sort of what they see in the next few months. Very, very happy to hear about the work happening with federally qualified health centers. As things begin to shift, what do you think the work of public housing authorities will be as we hopefully are moving into more of a recovery phase?
I can respond to that, Vivian, I guess, if it makes sense. I mean, I think right now the immediate focus is on just ensuring that we are bringing vaccines to everyone who can receive them, and certainly the follow-up to the letter that we'll be issuing tomorrow will be to ensure that we are creating awareness among all housing authorities, that they can reach out to health centers. We see the joint letter from our two secretaries as being a kind of a passport in case a housing authority has not been aware or maybe hasn't had some challenges with encouraging a health center to bring vaccines on site to residents. The letter will enable them to have the authority to say, we really think a vaccine clinic on site of our public housing is the way to go. And then again, to provide the health support there. What we're hearing from the health centers, and I do want to be really clear, the 1,470 community health centers, federally qualified health centers that have been brought on have been doing amazing and heroic work. I mean, they are, as you can imagine, we've asked, the federal government's asked them to do quite a bit over the last several months, and they've been willing partners. But that said, and many of you as housing authorities are also having challenges with staffing, right? So they're also facing struggles with staffing. That's probably one of the number one barriers. Second is certainly on vaccine hesitancy, but staffing is a key issue. HUD did issue some guidance to housing authorities on ways that resources that we provided to housing authorities through the CARES Act and otherwise can be used to supplement staffing efforts, can be used to facilitate vaccine clinics on site, can be used to help with transportation supplies to supplement. Again, health centers did receive additional resources, but to me, it's going to be about really how do we braid the resources both from the housing authority side as well as the health center side to make this happen. Beyond that, I hope that, again, the COVID vaccine effort becomes the place that a stronger partnership between health centers and housing authorities starts. The things that we've long known about in terms of the racial disparities, the sort of significant age, the fact that many public housing residents are older adults, the prevalence of chronic health conditions, all things that we've long known about public housing residents have all of a sudden become flagged as COVID risk factors, right? And I think it should wake us all of us up to realize that, as much as you all are housing authorities and therefore a significant source of affordable housing in the community, you also essentially are people who serve a highly vulnerable population, and that we can all do a better job together for more practically addressing housing needs. And I know when I speak to Secretary Fudge, her questions always about what does it mean for end users, the people who actually HUD assist at the end of the day, and how are we attending not only to their housing needs, but to their overall health and wellness, their food insecurity issues, as well as their access to healthcare. So, I think this is hopefully the place where, to the extent that you already are not working on addressing health needs, that we can build upon the partnerships that will be created over the next couple of months to think about how to bring healthcare home for as many public housing residents as possible.
Dr. Lemaye, I would really love to hear a little bit more about what a housing authority might be able to do, in your thoughts, to address some of the misinformation and create a more receptive environment for information about vaccines. I'll tell you, as I mentioned, we had a lot of very strong response at the senior buildings. We do have response at our family sites, but I do believe that we're going to have a lot more work to do to help people feel more comfortable, even when we bring vaccines on site.
No, it's a great question. And I think I just want to echo, I think some of the issues that I think Richard, Mr. Cho brought up. It's interesting for those of us that have been in the public health space. I think COVID has sort of laid bare, if you will, a lot of the inequities that have been happening in our country for a really long time, right? And it sort of brought them really front and center. And I think with regards to how do we sort of reduce that hesitancy and how do we continue to communicate, a couple of things that we have done that have really worked is essentially bringing in individuals that are in no way, shape, or form associated with the government, which I know sounds sort of opposite, I think, right, of what we would want to do. But because we're hearing so much distrust, right, I work specifically with African-American populations and have been for the last year pretty heavily. And the way that we've been doing that is essentially I've gone to about 40 different African-American churches, through the AME church network. And I essentially just serve as a vaccine resource person, right? And so I'm not associated with the government. I'm an independent scientist that is not funded in any way by the government. And it's really just a Q&A. It's just a listening session. We've done this a lot, not only within the churches, we've done this at the university level. As you can imagine, I'm at a school of public health that's within the medical institution, which is, I think, sort of well known throughout the world. And yet the number of people that have concerns about vaccines, even among staff, among faculty, and among employees is really high. So we've been holding these listening sessions where several of us are just literally there. We don't give a talk, right? It's literally an hour of just Q&A. And that is one thing that I think has really been quite effective, is essentially bringing people that have no connection to government, but also have no connection, I should say this, to pharmaceutical companies, right? A lot of us have to work hand in hand with pharmaceutical companies. That's how you get a vaccine product, right? I've had no funding through pharmaceutical companies, and that's really important for people to hear that when they're asking me questions. And so several of us have essentially been doing what I would call a bit of the circuit. I've been going to public libraries as well. And so I think tapping into this network of individuals that study vaccine science but are independent and bringing them to really just serve as resource persons goes a long way, so that's number one. I think the second piece that I would say is making sure that your buildings and your units are also equipped with evidence-based information, right? That is an easy step that you can take. The CDC has developed a huge slew of guidelines and of templates that you can essentially download, print, and then put up. That would be another option that I would say. With regards to the misinformation piece, I think that the other challenge that we have faced is, unfortunately, throughout this whole pandemic, we've seen a huge increase in the prevalence of mental health disorders that has increased throughout this pandemic. Part of that has to do with isolation, as you know. Part of that has to do with the fact that many people are losing family members, as you know. So I think being supportive through this holistic approach of what are the services that are available. I think Mr. Cho mentioned something about food insecurity. Some of the response, the way that we set up the response, and I'm based, I'm out of Baltimore. The response that we did in Baltimore was when we set up hotlines at the beginning, if you remember, it seems like an eon ago, when people wanted to get a COVID test, for example. One thing that we made sure was when we set up our call-in center, we also included essentially information about food assistance, housing assistance, all these other social services, to understand that this is a holistic approach. And I think you all are in that same space where you can make sure that you're really also promoting these other services, right? To build trust and to say, yes, we care about the vaccine. We want people to get the vaccine if it is the right choice for them. But we also understand that they're dealing with a number of other slew of factors that they might need social services for. And so one thing that we did is, as you can imagine, different residents are going to be able to interpret and, really feel comfortable with different types of information. And one thing that we did, especially at the beginning, a lot of these vaccine appointments, as you know, whether they're not at the site, they were essentially, you had to sign up online, which was a real challenge for a lot of our residents, as you can imagine. So what we did in Baltimore is we partnered with the utility company and essentially printed on the back of the utility bill, here's all the different social services that are available to you. We included vaccine as one piece of that, right? But literally, that was one way that we could really reach people. I spent about 10 years of my life overseas, and people think that this is bananas when I bring up this idea. But, in most of the other countries that I've worked in, you go door to door for social services, right? People come to you. It's not the other way. And I think you all have this structure already in place, right? That you're in a building, you have residents in a building. So you actually have the ability to really engage with people door to door, whether that's your building manager, and I apologize that I don't know the structure of how that works for you all, but you do have that ability, whether that's bringing in a health volunteer, to kind of go door to door to be like, do you have any questions, and kind of leaving it broad and open. But just having some of these things in place go a really long way in terms of rebuilding some of this trust that has really, I think, suffered for the last year, and just really meeting people where they are, right? I think that's the biggest issue is, we advised a number of states at the beginning that the vaccine appointments should not be done online. You obviously have seen what that has happened. That has led to disproportionate access. You see, essentially, if I can be very transparent here, you see white people going to predominantly African-American neighborhoods at the beginning and signing up for CVS slots there, right? It's essentially made inequity way worse. So I think the way to start to build that back is to really making sure that you are meeting people where they are. So, you know, having these face-to-face conversations, I agree, it is something that I think is going to be more time consuming, but it really does go a long way, essentially, in terms of building trust back, just generally in the government, including vaccines. So sorry, that was a really long-winded answer, Vivian. I hope that helped.
Vivian, can I just add to that or respond to that? I think that's spot on, and one of the reasons why we are the secretaries of HHS and HUD are directing, requesting, encouraging health centers and public housing authorities and HUD programs to partner and bring vaccines like on site into homes is because of what we've been hearing about vaccine hesitancy. It's not that people are saying, no, I don't want it, I don't trust it. It's they're approaching this with ambivalence. And sometimes all it takes is just a few logistical barriers to accessing the vaccine that make people put it off. And because they're, you know, ambivalent, they're of two minds. On the one hand, they're hearing about the need for protections. They want the protections, and, you know, CDC's been putting out great guidance about what you can now do. You can be outdoors if you've been fully vaccinated. You can visit with relatives if you've been fully vaccinated, right? So people want that. At the same time, they're fearful and mistrustful because there's a lot of misinformation out there. And so if you can just remove those barriers and bring it on site to people's homes, you know, it's almost like going back to the old days of doing home visits by doctors, you know, where they brought the black bag on site. I mean, that's kind of what I think it's going to take. And so maybe this will force us to think a little differently about shifting back to those, what we consider old-fashioned paradigms and modes of service delivery in the healthcare system. But for vulnerable populations, people who have challenges, like that is what it's going to take. And then a lot of what we've heard about of you know, what does it take to overcome vaccine hesitancy? It's having trusted medical professionals on site, not through a screen, but they're in person, who can tell you, let me talk to you about your concerns. And so in this age where many of us are now interacting through screens, right? It's that person-to-person contact by a trusted medical professional sometimes that helps them overcome it. So again, that's where we are in COVID response now, is we now have the ability, fortunately, because of the vaccine supply and because of the capacity that the federal government stood up, that we can do these highly targeted, I heard the term used, micro-targeted approaches. That's sort of where we are. And that is what we're hoping to do in this next phase of the COVID response. And that and vaccinating HUD-assisted households is a huge part of that.
No, that's thank you. We certainly have seen the benefit of doing weekly site-based testing, and we hope that we will encourage greater, even stronger participation as we move on with our site-based vaccine. At this time, I understand that there's some questions from the audience.
Yes, thank you so much. Yeah, so we'll take a couple of those, and if we have time, I know you had a couple others, Vivian, so we can return to them if time permits. So we did get a question first. I think this would probably be for Dr. LeMay, about for parents with young children, how important is it for the parents to be tested and vaccinated?
It's a really great question. And as someone that falls directly in that boat, it has been an ongoing challenge. So my 4 and 7-year-old have been home with my husband and I for the last year, as he and I both work full-time jobs. And as you can imagine, I've been pulling quite a number of long work days. One thing that I will say is that the CDC guidance does make it very clear with regards to who you can hang out with, right? So they've essentially come up with those infographics, and I'll drop them in the chat if you'd like me to, but that's essentially like, I think it's like the 2 out of 3 approach, right? If you're both vaccinated, if you're outside, if you're sick, right? So it's different ways in terms of thinking about your risk. I think from our perspective, for those of us that have children that aren't going to fall within the 12 to 15 range, right, as they start to roll out Pfizer, especially among that population, I think it's really important to think about your risks of exposure. So I feel like I get this question a lot. People are like, you know, Rupali, why do you still wear your mask, right? You're fully vaccinated. Your husband is vaxxed. So adults in our home are all fully vaccinated. Our children are not. So when you hang out with vaccinated people, why do you still wear a mask? And, you know, my argument is because my kids, even though they've been home, they go outside, they play with other kids. Yes, they wear masks, but there's still a small risk of exposure. To me, it's really your comfort level is what I would say with regards to what you feel comfortable doing. We see individuals that are in higher risk categories at higher risk of exposure and higher risk for complications and severity of COVID. That's the reason I do that. If I was not hanging out with anyone like that, then I think that, you know, it's really important for you to feel comfortable. However, I will say this, and again, I'm saying this from a point of privilege, and I will acknowledge that I'm allowed to be home. I've been working from home this whole time, right? I can limit my exposure. For those individuals that are not able to limit their exposure, that's why it is so important to continue to think about, if you can, again, continue to wear a mask if you can, even if you're vaccinated. And the reason I say that is because we have just not reached a community immunity. We just don't have enough people that are protected yet that will allow us to get to that point. And again, I think it's really weighing your comfort in terms of who you're going to see, who you're going to be exposed to, what is your risk of exposure. But in general, in terms of testing, and if you have young kids that are going to daycare centers, you know, there was a study that just came out that essentially showed that, you know, kids are really, for the most part, 90% are asymptomatic. They're not going to have any symptoms, right? They can have COVID, they can transmit COVID. And, you know, luckily for you, if you're vaccinated, your risk of having severe COVID is essentially zero, is what we found so far, right? You're essentially not going to have severe COVID if you've been vaccinated. But to me, it's more protecting those that if you're hanging out with someone that might be vulnerable. And that would then depend on how you want to modify your own behaviors, if you will. You know, I work at a university that is requiring all students. We've been offline for the full year. We've been, online. We're going to be in person starting in the fall, but we are a university that is requiring every single person, if you step on campus, you have to be vaccinated. And that's for this, right? We want to really protect those that are most vulnerable. It's not about my protection or, you know, someone else that's sort of my age that doesn't have high risk factors. It's for those individuals that are vulnerable.
Great. I think this next question is more for Mr. Cho and Ms. Brady Phillips. Someone writes, just pull it up here again. More jurisdictions released people from jails or sped up parole processes to get people out of prison in response to the pandemic. How can housing authorities use their discretion to help people with justice system involvement safely return home?
I don't know if Vivian, if you want to take that one first. I would say, I mean, we've heard, first of all, let me say, what's happened over the last year is nothing short of remarkable, where we've seen prison and jail rates go down all over the country, raising interesting questions about why there were so many people in prisons and jails in the first place. But we've seen both efforts to try to help facilitate releases of people from prisons and jails, as well as reduce arrests and new admissions to jails, which I think initially dropped fairly significantly in the early days of the pandemic. Most researchers now believe had to do with a lot of the stay-at-home orders from states, where that had a just interesting effect on reducing crime, but also policing practices that shifted due to COVID as well. Some of that may have subsided, and maybe some rise in new jail admissions, but we've created an interesting historic opportunity now to really rethink our prison system and to help people stay in the community. But key to that is going to be housing. And what we actually saw, I'll step out of my HUD role for a second. I was working in a state context before coming back to the federal government. And, you know, one of the limiting factors we saw as there was pressure on prison systems to try to release people to the community was the lack of housing. And so I think this is a really important question. I think this is something that just earlier today had a team meeting at HUD with several colleagues from across different HUD departments, thinking about the things that HUD can do further to address the housing needs of people, returning citizens and people with criminal records. And so following on past guidance that HUD has already provided, encouraging housing authorities to look at their tenant selection policies, their criminal history screening policies is certainly one aspect. Also, the disparate impact memo that was issued in 2016 indicating to all landlords, not just housing authorities, that blanket denials on the basis of a criminal record, looking at arrests as opposed to convictions, looking at convictions that have nothing to do with safety of other residents are things that could potentially be a violation of fair housing, given the racial disparities in the criminal justice system. But we'll be doing a lot more going forward to really encourage that. I would say, heard great examples all across the country of housing authorities creating limited preferences and set-asides of vouchers where people who are connected to reentry services, formerly incarcerated people can access housing choice vouchers. My own home state, New Haven Housing Authority, Karen Du Bois Walton had created a special purpose voucher or like a set-aside using a regular voucher, I should say, to serve people who are reentering from prisons. Springfield, Massachusetts, many other housing authorities that I've heard of have done that. And I think those are the kind of practices HUD will be looking at to try to encourage. So I'd say two things. One is on the screening and admissions policies. And second would be looking at ways to proactively partner with agencies that provide reentry services and supports and think about ways to couple vouchers. This is an exciting time for special purpose vouchers. Some of you know in a couple days or weeks, we'll be announcing the $5 billion in vouchers that we received through the American Rescue Plan that will mean many thousands of vouchers will be awarded to housing authorities across the country to serve people who are experiencing or at risk of homelessness. And that can include people who are being discharged from prisons and jails. So I'm really hoping to see some service partnerships stood up and housing authorities be able to take advantage of that to really reduce homelessness, including among people who are falling into homelessness after their release from prison.
I would just, I think one of the challenges we have is our wait list, but more importantly, I think that the pandemic has really opened up an opportunity for us in Jersey City to partner with the city, the county, and other partners to really focus on housing resources in a different way. And we're very happy to be working with the city on its emergency rental assistance and also on its emergency solutions grant to do more landlord liaison work with them and other nonprofit partners that are serving different populations of homeless people experiencing homelessness in the community. So I think the experience of COVID has really made us think about how do we position ourselves as a housing authority to be a greater resource in different ways than we had traditionally. And we would, of course, expect that a sizable number of those individuals who are also those who have criminal justice involvement.
Great, thank you.
Barbara, let me add to that. Just like, COVID's forcing us to think about how to think about housing needs in interesting ways and take into account COVID risk factors in that. And so we're at a time when the last year, when everyone was told to stay safe by staying home, right? There were like almost 600,000 people who were homeless, who had no place to stay safe and by staying home. You had people in congregate settings, shelters, but also group homes and nursing homes and prisons and jails, right? Where they were probably the most at highest risk of COVID transmission and illness because of the fact that they were living in close proximity. And so, housing authorities have a huge role to play, not in just meeting housing needs in general, but also being part of this public health response and being clear that the best way we can protect a lot of people is not only through masks and vaccines, but also by giving them the ability to have a home in which to stay safe in. And so I think it really challenges all of us to think about how do we prioritize those populations, such as those who are homeless, those that are in nursing homes, and those that are, in prisons or jails who have no ability, where they're held in prisons, they're eligible for release, but they can't leave because they have no stable home. And I think those are the kind of populations that I would encourage all of you to think hard about how do we use the resources we have to reach them, because of the fact that this is life or death now.
Absolutely. And that segues very nicely into what I think will probably be our last question for today, which is for everyone to respond. sort of thinking through, what do you think the lasting impacts, particularly for the populations we've been talking about, will be from the pandemic, and what supports can and should we be implementing or continuing?
And quickly talk about, I think, some of the public health impacts. I just touched upon them a little bit earlier. I think we're seeing huge increases with regards to mental health. That continues to be a problem. Opioid is another huge issue that we have been following currently throughout this pandemic. And it's especially because where I'm located, West Virginia is one of our hardest hit. Ohio, this whole Appalachian belt, we've had issues with regards to opioid overdose, which continues to be a concern. I think the other piece that's going to be, I think, quite challenging in a lot of ways is just adjustment back into sort of a social life. I think I've talked to so many people now that I think are used to this and are just scared of going back to normal life. And so I think even normalizing and having get-togethers in your buildings outside, whether that's just have people bring their own coffee. I mean, I really think we're doing a lot of these things that seem like very, very small, minor things, but really do make a huge difference for individuals to feel as though that they're connected again, and that there is a neighborhood, there is social capital around them that they can tap into. I have to say, the one thing that I have learned more than anything throughout this pandemic is, I spent a lot of time setting up and getting vaccine appointments for my neighbors, many of which down the street I didn't know before the pandemic, but now I know very well because they were older individuals that just didn't feel comfortable and didn't know how to navigate the online system. And so it's been really fascinating to remember that, I think people are here to help you out, and just to continue to, I think, nurture that is going to be really important, because I think we are going to have a number of mental health challenges as well, I would say, in the year ahead among all residents.
I would say from a public housing authority perspective, really rethinking, as we're just talking about, our role as an anchor institution and serving a broader number of residents in different ways, right? We have our vouchers and our traditional public housing, but we are now beginning to explore ways to support other types of housing supports in the community. I think we have a resident services division that keeps growing. And I think it needs to continue to grow, which is always a funding challenge for the work that we do. But this has shown that it's critically important to address what some of the respective issues are and the ongoing ones. And I think third for us, the continued investment in digital inclusion, which is critical for connecting everyone from, I was listening to the radio today, New York City said there's no longer going to be snow days. Everybody's going to go to school. I think the new normal is that people are connected, and we need to make sure that our residents are connected. And it's not just the young people, it's from the young people to the seniors and everybody in between.
I will echo everything that Dr. LeMay and Vivian, you both mentioned. Behavioral health is key, right? That's something we saw throughout the pandemic, as it was not only about COVID risk, but having people be isolated from one another has also had negative health impacts. And then Vivian, to your point, you're dealing with an administration and a president and Secretary Fudge who are making the case to the public that housing is infrastructure, broadband is infrastructure, and that caregiving is infrastructure. There's a new opportunity here. And so when you ask about what are the supports we should be thinking about, I think this is a new moment to think about the ways that we can really scale up housing and services as a package for the populations, not only primary care supports for public housing residents, but also knowing how many of your residents are older adults and people with disabilities, right? New opportunities to pair this with the significant resources that President Biden's asking for in the American Jobs Plan, over $400 billion in home and community-based services that can provide wraparound supports to help older adults to age in place and people with disabilities to be able to safely integrate into communities. That could be paired with mainstream vouchers that can assist people experiencing homelessness and people leaving prisons who have disabilities. I would encourage all of you to really read up and study up quickly on home and community-based services and the opportunities to really connect the dots between your housing that you administer and the services that now states could potentially have the opportunity to scale up to provide those home-based wraparound supports.
Great. Well, thank you so much to the three of you for joining us this afternoon. We really appreciate your time and your expertise. I know that some folks are very interested in following up with you after, so we will be in touch about that possibility. But I think with that, Hannah, if you want to bring up the next slide, we are going to be taking a 15-minute break, breakout sessions. Yep, stretch, walk around, open the window. Breakout sessions will be starting at 2:45 p.m. Eastern. And you can see here on the screen, you should have also received this in an email earlier today. These are the different sessions we have on offer today. We have a session on countering the climate crisis, one on out of school, what that's been looking like this past year and what will continue to look like, and then another on addressing the digital divide. And this digital divide session is specifically on COVID-19 efforts. So please do join us. If you have any questions, feel free to drop them in the chat. We'll have some staff hanging around to answer any questions for you, but we look forward to seeing you at 2:45. Thanks so much.